Welcome to today's webinar hosted by eLotus, your leading provider of acupuncture continuing education. I'm Donna Chow, your host and your moderator for today's exciting class. For over 2 decades, eLotus has been organizing continuing education, and today's session is truly exceptional. We had the privilege of being joined by one of the most esteemed Chinese acupuncturists in the country. This master practitioner is over 80 years old, boasting a remarkable 50 years of clinical experience. With a rich background of studying under numerous masters, he's eagerly looking forward to share his vast knowledge on achieving the best results with acupuncture. Today's webinar, Ashi Points for Headaches, Master Lessons of Over 50 Years, will be presented by the esteemed Dr. Kai-Fong Tiu. The class will run from 9 to 1 p.m. Pacific time with a short break in the middle. Before we delve into the class content, let's go over some important details regarding the chat room, questions for our instructor, and the CEU quiz. In the chat room, please set your chat preference to everyone so that all attendees can engage in the conversation. For questions for Dr. Tiu, kindly type them into the Q&A box. As for the CEU quiz, the quiz will be available to you within 24 hours, so please look out for an email to notify you when it's available. Our speaker today is the highly skilled Dr. Tiu, renowned for his specialization in treating sports injuries and musculoskeletal traumas. With over 5 decades of experience, his patients often experience immediate relief and swift recovery from pain. Dr. Tiu previously served as a professor at the Chinese Academy of Traditional Chinese Medicine, Orthopedics, and Traumatology, and is a distinguished member of the Chinese Pain Society. Today's class will be a unique experience as Dr. Tiu will deliver his teachings in Mandarin Chinese with Tina Chen providing English translation. This format will mimic the experience of studying at a TCM hospital in China where you can observe everything the teacher does in the clinic with the aid of a translator. Unlike some TCM practitioners who guard their knowledge, Dr. Tiu is eager to share everything he knows, aligning with our vision of spreading TCM to the Western world. As he does speak slowly and faces some hearing challenges due to his age, we kindly request your patience. Throughout the class, he will generously share the essence of acupuncture, offering pearls of wisdom and practical demonstrations so that you can witness and learn precisely how to achieve immediate results. Don't be afraid to ask your questions because there are no silly questions. The more that we ask, the more that we can learn from Dr. Tiu's 50 years of wisdom. Let's embark on this enriching journey together with Dr. Tiu and Tina Chen. Get ready to gain invaluable insights into the art of acupuncture and elevate your practice to new heights. Let's get started.
Good morning, everyone. Can you hear me? If you can, please type into the chat room. Please put yes. Good, good. And let's test Dr. Tiu's mic. 但是你可以说一些话吗？看看你的麦克风。
可以啊，可以吗？这个有。
Can everybody hear him?
可以，可以，可以。
Okay, good. So welcome everyone. It's good to see you on online and see you in our class again. If you're new to the class, can you type into the chat room new so we know how many new students we have today? New. Great to see you. Yeah, if you can type in also in the chat room, how did you hear about today's class? Was it from a referral? Was it on Facebook, e-ad, or whatever it is? Let us know too. Great. Okay, and if you have been here before at least once or twice or 3 times, you are familiar with this method. Can you put into the chat room how many times you've been to Dr. Tiu's class so I can let him know too? Just put once if you've been here once, 2 if you've been here twice, and so on. 我在上面写啊，有人一来是1次、2次、3次、4次，有的人没来过，大部分大概一半吧，一半的人。
一半有听过，有半没。
对，一半有听过，一半没听过。对 ，Okay, wonderful. So if you have been here before, just out of curiosity, because I've gotten feedbacks personally from students and clients of mine who's tried his technique. Some even took pictures and showed me their wet cupping. So that was very interesting. And then they said that, wow, the effect is very good for really acute and severe cases. So if you've had that kind of experience, feel free to share with everybody too in the chat room your experience using this method treating the patients and how you found it different than the other methods. So we can all learn from one another. Okay? All right, so today's class is on treating headaches. So in addition to just treating headaches, I'm going to ask him towards the end what his experience has been in treating other problems related to the head. For example, TMJ, facial paralysis, herpes, right? Teeth grinding, and also Meniere's. So all this we'll save until the end of the class. I'll let you know what he said about how to treat those. But today's focus is on treating the pain on the head. And we will have 3 to 4 demo cases coming in today after the first 30 seconds of lecture. Sorry. Okay. So if you've been to this class before, you can go for a little coffee break for the first 15 minutes or 20 minutes because I'm going to go over Dr. Dell's needling strategies and also principles. So we have done this for the last, 6, 7, or 8 classes where I go over this first and then we'll do the demo. So you've heard of this before. You don't have to be here for this first session. But if you want to review, you're welcome to stay. Okay, so let's get started here. So the flow of today is the overview first, and then the demo, and then we will do the Q&A. And I do encourage everyone to ask questions. There are no dumb questions, okay? We're on the path to become a good practitioner or a great practitioner one day, or an excellent practitioner. So what we can do is learn from doctors who have more experience than us, and he happens to have 50 years, so that's great. I love these doctors, and he is a very genuine Chinese doctor who is willing to share everything, and that is a very rare gem because if you know us Chinese, we don't the teachers don't really like to pass down information to students very easily. Usually you had to, the old style is you had to 拜师, which means you had to, they had to take you in and you had to be a disciple and then be the master and then probably sweep the floor for a year. It's a very different tradition than here in America, but we're very fortunate today to have Dr. Dao here because he's in his 80s already. And so he feels the need to have to pass this information down. So whatever questions you have, please feel free to ask. And then, please put it in the Q&A section. There's a chat room and there's the Q&A. Please put in that so we can keep all the questions organized. And I will ask him, translate, and then ask him so he can share his wisdom with us. And then finally, at the end, if he has any advice for new practitioners, if you have time, he will tell you. So when you first graduated, there are so many different styles, right? As you can see here, I'm sure you have already found some affinity to one or more of these styles. And because I have been in the profession for so long, I have met so many different teachers. My conclusion is that every technique works for certain things, and there is a strength of each kind of technique, and there's also a deficiency too. There's no one thing like in Crouching Tigers, like the sword that can just defeat all enemies. Different weapons have different uses, just like these different techniques. They are good for certain things. And his method, I feel personally, after a year of going over these classes, is that it's very good for acute problems, severe problems, because it is a very aggressive treatment. And unless your patient has that, it's very acute and very severe, you don't need to bring out this big gun here, because I feel I have also been treated by him and it's very painful because it was for my neck. And then when he needled me with his 32 gauge needle, it felt like the head was going to come off. But then after the treatment, it felt great. So unless your patient is really suffering, this method, you can save for later, because some patients might be too sensitive to be able to tolerate it. All right, next slide is Dr. Diao learned from many different teachers in his 60s, 70s, and 80s. He practiced in Hong Kong before. He also had a Chinese Acupuncture Association where he invited different teachers to come to his associations to teach, sort of like what we're doing here today. So back in the 70s and 80s, he was able to do that. He invited a lot of good doctors from China to give classes. And that was also one way where he was able to learn very fast. So after he learned different styles, he concluded what is most effective and what was the easiest for him was this Ashi style needling. So this is not just a very easy kind of Ashi style where the patient is pain here, you just needle there. In essence, it sort of is, but also it's not, because there's a lot more to it than just that. Okay, so we're gonna go over each of these little gems that we have collected from the first class to up to now, because every time after one class, if somebody asks a really great question that is not in the notes, or he shares one more clinical wisdom, I will put it in here. So this lecture notes is ever growing, if you will. Okay, to include more and more information. So first of all, what you want to do is you want to ask the patient to identify the most painful area first. Okay. Then the next thing you want to do is after that, you use your own finger, usually the left hand if you're right-handed, use your left hand to palpate for what is hard or if there's a knot or cord underneath. And this doesn't come easily because in the beginning, even now, I still don't feel anything. So the more you feel on the patient's body, the more you will be able to quickly identify this cord or this hardness. And that's when number 3, you need to hold that tendon or hold that knot. This is a key that is very, very different than what you have been taught with Ashi needling maybe before, is if you don't hold it, it's going to slip away. So you need to hold it like he says, take the other hand with the needle and the needle right into that while you stabilize that knot or that cord, or that hardness. And another very important tip, number 5, is your needle needs to elicit the chi sensation. So in all the previous 7, 8 classes that we've had, every time we needle the patient, he would always ask, do you feel the soreness? Do you feel the distension? Because if they don't feel anything, then you did not get the point and the treatment is going to be ineffective or, not as effective as it should be. So if you don't get the sensation, pull the needle back up, maybe not all the way out, change an angle and make sure you're still holding on to the knot. So the 2 most important points of this slide is the palpating hand is actually more important than the needling hand because you need to palpate for where the knot is and then hold the knot. The second most important is your needle sensation has to produce that sensation of the qi. So you cannot just stick it in and then just let the needle do the magic. Okay, for this technique, it doesn't work like that. Okay, next slide. Now, he says, if you're looking for the Ashi point or the knot and you cannot find it, you need to expand your area of search until you find the point or the knot. So that's an important concept here because sometimes you're going to feel like, ooh, all the surrounding tissue or where the patient says there's pain feels all the same. And if you were here for the last class, I believe, one of the patient had wrist pain. Or the previous class, 2 previous classes, I think. The wrist pain patient, he palpated all the way up to the elbow and needle up to here. So it's not even at where the point of pain is. So that's what this idea is. Make sure if you don't feel anything, expand the area of search. Okay? Next slide. The needling hand is not as important as the other hand, especially if it's a tendon. So tendons, he says, tends to be slippery. They move around a lot. If the patient changes position or if you forgot where it is or whatever. So make sure you hold it and you're needling right into the tendon. Okay. Oh, and one more tip that I didn't put down in here is that he said most of the time, 80% of the time, the problem is with the tendon, not so much with the muscles. So that's a little tip for you. Okay, number 3. He uses gauge 30 needles, so it's rather thick. So if you're into Chinese style needling, this is great. If you're not, then use a thinner needle. Patients can come back a couple more times if they cannot tolerate such a strong stimulation. I remember Dr. Tan used to, Dr. Richard Tan from years ago when I met him maybe 20 years ago. He told me that he used to come out and then he would have a tray of needles for the patients, the gauge starting from 30 all the way to 42. And then he would ask the patient to choose, which would you like, And I asked him, why does he do that? And what patients usually say, and what do you say to the patients? And then he said that, yeah, I let them choose. If they choose the thinner needle, I just tell them it's more painless, but the treatment, frequency will take more times. But if you choose the thicker needles, maybe you only need to come back once or twice. So for this treatment, we're doing the gauge 30. Number 4 tip is he always wears gloves in his clinic when he's needling. He does bloodletting on a lot of patients because most of them are very severe. So when it's very severe, the bloodletting works incredibly well. We have seen it so many times. One of the patients even took time to write us a really long thank you letter to say that she's finally able to sleep after 10 years of pain, that this one treatment relieved it that much. So the bloodletting is very, very important and very, very effective. Okay, next slide. Use as many needles as necessary to relieve the hardness and the pain. So you will see that sometimes in one Ashi area, he will use up to 5 to 10 needles. That seems like a lot. But in the beginning, what he will do is you will see him use a couple on the most painful points. And then if the patient continues still to have pain, he will expand the area of needling just to cover all the pain. It's kind of like the bullseye, when you're shooting darts, you have the central point of pain, but then the other areas are also effective because the pain usually is just been around for a while, because until they come to you, they may have had it for at least a week, a month, or a year. So sometimes the pain, has a bigger area. Then he likes to just address it all so they don't need to come back. He charges $120 for a treatment. And then he usually likes to tell a patient just to come and let's just treat one problem at a time. And if that's enough, you don't need to come back. He's not the type of practitioner who will milk the patients and tell them to come back. Okay, 10 times, we'll just treat a little bit at a time. So he will use as many needles as necessary to cover the entire area of pain. Okay. Next. This is the same idea. Work first on the primary area and then work on the secondary area. So these notes are basically conclusions that I'm going over from all the questions that we've had for him. Later on, when you have a question yourself, you can always come back to the notes to try to find the answers. They are not phrased in a question and answer way. They're just kind of like the answer. So many times, in the past classes, people will ask questions, but if I don't answer, excuse me, we're probably busy doing, something else or working with the patient. You can always find the answers in the lecture notes. Okay, next one. Dirty is important. When you touch the knot, you need to move it up and down to break it up. Don't just touch it. You need to penetrate it. All right, so here is an example. If this is the skin, here's the knot. Your needle is coming in, right? So what he does is he needs the needle to penetrate through the knot, right? Don't just touch the knot. Go through the knot, and if you need to, move it up and down to break it up. Got it? Okay, next. When patients are very sensitive to pain, before needling or bleeding, do cupping first. So this is kind of like the same idea as kind of giving the patient's body a warning that something is about to happen on that skin. So one of my patients actually taught me this one time is I used to always just go in, okay, I just needle here, 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 here. So the patient kind of is like in a shock, So later on that patient told me, hey, before you needle, can you kind of give me the heads up by kind of rubbing the area or touching the area a bit with the tube? and then, tapping on the side a bit, and then inserting the needle. Not like how I used to do it. I just kind of know where I'm needling and I just go into needle, because that's how I learned it in Chinese hospitals. But then the patients here, I guess, are a little bit different, and this is actually the more gentler way to acclimate the patient into the treatment. So same thing here. The patients are very sensitive to pain. What he will do is he will do cupping first. And when you do the cupping and you have worked on the area usually more numb and usually will have more blood. And then they will usually feel less sensitivity. So when you're needling, it's not as painful. So this is a good tip. Okay. Next. So there is no need to leave the needles in for 30 to 40 minutes. If you have already gotten the qi sensation or the feeling of, distension or the feeling of the qi sensation, you can already stop, because that needle has already done its job and it has worked. But he says this, which is very brutally honest. He says, if the patient still prefers you to leave the needles in, they can, he lets them sleep in the treatment room for 30 to 40 minutes and they feel relaxed. And then they usually fall asleep. And then when they wake up, the body will feel much better, even without the needles, if you have fallen asleep and rested, right? And with the needle, with the treatment, they will feel even better. So sometimes he says that they'll feel like they got their money worth more. So in that case, yeah, just do that. Whatever they prefer is fine. If they're in a hurry, they can go. If they're not, they can rest. But what he's trying to tell us here is that the effect of the needle is not really in that 30, 40 minutes of rest. It's really in that whether you get the qi sensation or not. That's what's important. Okay, next. This one is very important here, number 10, that his technique is a little bit different than other acupuncture techniques, where I'm sure you have experience. When you stick the needles in, the pain goes away, but the pain comes back the next day or after a few hours, which makes it very annoying for the patient, because they'll feel like, oh, this is just a temporary Band-Aid treatment, Then they have to come back several times a week. Sometimes they cannot afford to do that. But with this method, it's a little bit different. Dr. Dell's method, because he works on the area so much, that area is going to be very sensitive and painful, usually. So sometimes there will be more pain than what the patient is experiencing. And sometimes there's relief, but nonetheless, they will feel like that area has been worked on. So what you want to tell the patient is that if you feel the same, or you feel like there is some looseness, but there's still a lot of pain because it's been worked on, that sensation is going to dissipate as time goes by. So the next day, the following day, the pain level is just going to keep coming down. It's not going to come back up like the other method where it works now, but then the pain returns immediately. So this is a little bit different. So in order for the patient not to mistaken you that you have done wrong to them, you need to explain this to them first. It's very much like giving blood movers. Whenever I give blood movers, especially strong blood movers, like the ones with the leech or whatever bugs inside, you need to tell the patient that some patients will experience more pain before relief. Because when you're using such an aggressive blood mover to get rid of the masses, it's kind of like remodeling, there'll be a lot of debris everywhere and mess before the new remodel house is present. So because of all the whatever junk and garbage that's going to be rolled out, the body has to metabolize all that. The patient might feel more pain. So especially headache patients, I tell them sometimes you'll get more headache, more severe pain. And in that case, just either cut the dose in half or stop the herbs for a few days and then go back on it. Give the body a rest, and then we'll continue to move the blood and remodel. So same idea here. This method is the pain level is gonna be either more or the same, and then it will gradually decline and then not come back. Something to express and tell the patient. The next tip, this was from August, that if the location of pain cannot be needled, somebody asked this question actually. The pain is at the eye and the balls. What do you do? So he said, expand the area of search and look for pain and Ashi point around that area to needle. Okay. Next, Does Dr. Dell use TDP lamp? No, he does not, but he does say that it does provide the patient comfort. And if you're going to leave them there to sleep, then it's good to turn that on. They feel more, like their money is worth more for the treatment. And then the September class, somebody asked, does he use electrostim? So he said no, he doesn't need to do the electrostim because whatever he's doing already is very strong stimulation. Contraindications. Okay, when can you not use this method? Number one, during pregnancy. So when he says you have a pregnant patient, you want to be careful on the points on the back. Don't needle if they're 8 months or more pregnant. And also number two, the thoracic points. Pneumothorax could happen easily. He showed us, I think in class 2 or 3, how to needle the upper back points correctly. So he says, don't do it if you have never done it. It's just to be safe. It's better to use other points. When to bleed. Okay, so we're into the section of bloodletting now. We finished with the acupuncture. So he says, when there is no obvious pain or not, there are some patients who will be like that. They'll come, they'll tell you either pain is everywhere or nowhere that really they can pinpoint. So in that case, you want to do bloodletting or cupping first. So this is talking about like if they have pain on the elbow, for example, but there is no one point that is painful. It's kind of like just generally there, So then he would do the cupping first. And then the Ashi point usually will surface after that. Another tip is wear disposable gloves, use disposable cups. We're going to show you the disposable cups that we buy. It's a Korean brand. There is a cup, and then there is also an inner lining. Have you guys seen that before? Let me show you now. Do you need to focus? Here's the brand that we use. Ooh. This one is a Korean brand. Looks like this inside. It's a pretty generic, just a plastic cup. And then we use a lining inside. Oh. This is the liner. So it looks like this. Oops, like this. So the way it works is, here's the cup, right? Here's the cup. So the liner goes inside. What? So you can see that the liner covers the side of the cup. Is it clear? It's not focused? Can you guys see? Is it focused? Yeah, okay. So you can see, right, the liner covers. So when this is not touching the skin. It's the liner that's touching the skin. So when you do the wet cupping, at the end, you just throw this away. You can reuse this. However, Dr. Dell doesn't like to use the liner because this is too little blood. We usually take out a lot more blood than this. Usually it's like a third of a cup or half a cup. But he likes to just use this cup and not the liner. So how does he sterilize this? He doesn't. He just throws it away or he gives it to the patient. Patient takes it home, sterilize it themselves. He tells them to do that and then bring it back if they need to in the future to do future cupping. Okay, so this is what we use. And make sure you guys follow your clean needle technique and bloodletting protocols in your state or in your country, because it's very important that we don't cross-contaminate and, injure anybody that we don't need to, okay? When he's doing bloodletting, generally speaking, he's poking about 3 to 5 holes per cup. So on the skin, here he's using a lancet device to poke the needles 3 to 5 times for very mild cases. But he does like 10, sometimes to 20 pokes for severe cases. So you will see that today. Today probably is a little bit different. I have actually not seen him treat any headaches. So I'm waiting to see too, because right here on the head is not somewhere where you can cup. So you're going to see a little bit different of a treatment, usual treatment. We do have a lot of his videos that I have taken in his clinic that are on YouTube. So Rina will help me post the link for you guys if you want to see his playlist on the eLotus channel. You can see how he works on different parts of the body. But today's class is maybe a little bit different. I don't know yet because I don't know how he's going to treat the head. So for more severe pain, the more holes that he would puncture, so 10 to 20. Now, if the case is severe, he'll use the cup to bleed the patient first, and then needle next. So instead of needling first, he will bloodlet first. So we had a class on chronic pain and we had a class on acute pain. So the gist of those classes, the biggest difference is for acute pain, you bleed first and then you needle. For chronic pain, you just needle. And if that's not good enough to relieve the pain, then bleed. So that's pretty much the 2-minute summary for the 2 classes. Okay, the next slide says, after bloodletting, you want to tell the patient not to shower or take a bath for 12 hours. Kind of like cupping, same thing. You don't, cupping, moxa, you don't want to shower after 12 hours. You don't want the damp pathogenic factor to come in. Okay, and then next, you don't need to put on any ointment after you bloodlet the patient. You just let the the wound heal by itself because you have already sterilized the point. Next, on areas where you cannot needle or bloodlet, it's better. On areas where you cannot needle, it's better to bloodlet. So he showed us that in one of the first classes where in the finger joints is where it's really painful to needle, he would just bloodlet. And that looked really painful too, to be honest with you. Okay, next, the example where you cannot needle would be this bladder 43, fingers and toes. So bone membranes, fascia that you can bleed and he'll squeeze because it's too small of a place for you to put any cup there to suck out any blood. So he will just squeeze. Okay, next. Oh, here's what I was saying. When treating acute pain, bleed first, needle second. When treating chronic pain, needle first and bleed later if necessary. Next slide. Okay. The pro tip, this is from the August class. For acute pain, the more blood you let out, the faster the relief. So in the beginning, if you haven't seen, it looks very aggressive and looks very scary. So if you're a beginner to this, don't go that aggressively. Just let a little bit blood out and just see how you feel, how the patient feels, because the way to convey that you're going to bloodlet them is also scary. Because if you tell them, oh, okay, we're going to bleed you now, then, they will kind of get scared. I don't know. One of the participants had a very good way of communicating that you're going to bloodlet them now. If you can type into the chat room for us all to kind of learn from one another, what is the best way to communicate that you're going to do the wet cupping without scaring the patient? What is the proper terminology to say? What do you guys say to the patients? Okay. Next is bleeding will be minimal to none once the stagnated blood has been let out. So this is a question that I've had for him before, and for my other bloodletting teachers, because sometimes it just seems like the blood keeps coming out and it's just nonstop. One time I let out a patient, he's diabetic. But aside from being diabetic, his, the veins around the ankles, wow, were very, very dark. So I bloodlet him. And it just seemed like the blood kept going for like 10 minutes straight. But finally, it stopped. So whenever I catch a teacher who does the bloodletting, I always ask this question, and this is the conclusion that I get too. The blood will stop bleeding once the stagnated portion has all been let out. That much blood has to come out. But of course, that's given that you didn't poke too deep with the lancet device, right? So we're going to show you what lancet device he uses in a bit. If you're using the freehand, hollow or non-hollow silicone or whatever device you're using, if it doesn't have a cap to catch the depth or to control the depth, you might go into deep, right? So in that case, they might bleed more than they need to. So this is something that you need to practice on. Bloodletting is not easy of an art. I recommend you practicing on yourself first. Once you practice on yourself and practice on these different parts, you know how to control your hand and fingers better and how deep you should go. But the idea is that the blood will stop once the stagnated pool is let out already. Okay, so don't be afraid. And also with the cup too, right? Because initially you might think, well, you're using the cup to suck out more blood, so there might be too much blood. But no, that's not the case. Once whatever stagnated has been sucked out, the suction of the cup cannot suck out anymore. Okay? All right, let's go to the next slide. In class 3, we saw some patients with no specific area of pain. In such cases, don't retain the needles. Find the most painful areas, needle and take it out, needle and take it out, and needle and take it out. So that was what we saw in that. That was very interesting. That patient had pain just everywhere. And then another tip in August, how long is a session of bloodletting with a cup? So generally it's 5 to 10 minutes or until the blood congeals. So that question was for him because we don't know exactly when we should stop. I mean, you can't tell, right? Because underneath, here's the skin, here's the cup. The blood keeps coming out. You don't know if it's still coming out. I mean, when do you take out the cup? So basically you look until the blood congeals is when you will take it out. So that generally takes 5 to 10 minutes. Don't go longer than that. Okay, somebody also asked, how do we control the amount of blood being sucked out in the cup? So here are 4 criteria. One is how deep you're needling. So he's using a lancet needle freehand. So his hand is very steady. So he's going in generally at the same depth. But if you're not using a lancet pen, you're just using a 3H needle or other needles freehand, then you need to be very consistent because, sometimes you might go too deep. Number 2, the number of pokes will also determine how much blood will be sucked out, right? I mean, the more you poke, the more blood obviously will come out. So if it's a severe case, then you want to do more, 10 to 15 pokes. Not so severe, 3 to 5 pokes is enough. Number 3, the number of pumps, right, from the cupping device. The more you squeeze, obviously, right, the more suction force will be there and more blood will come out. So generally speaking, when you're doing this, it's until you see the skin becomes a little bit purple or the skin is sucked to fill about 1/3 or half of the cup is when you should stop sucking. You don't want it to be too strong, basically. And then number 4, the length of time. So you just wait until the blood congeals, then you can stop. Okay, next. What does it mean when you see bubbles in the blood, in the cup? So those are not qi coming out from the body, okay? Some people explain that so esoteric. It's just not. It's just because the suction is not tight, so air leaks in, then there's bubbles. So in that case, you want to try to close it more and suck a little bit more so it's tighter, or redo it. This class in August, somebody also asked, how do you bleed the extremities? So first you bleed the painful spot or the joint. Second, you bleed the area that is swollen, and then let the blood flows out naturally. If that doesn't happen, then you squeeze to let the blood out. And another tip that I learned from Dr. Li Chun Huang on how to bleed, she specializes in the ear, right? And then she told me that, when you're cleaning the ear, you can use alcohol that is 75% or 90%. Either one is okay to sterilize. But when you want to bleed, you want to massage the area first. So when she's massaging the area, she says that if you use the 90% alcohol, it's a little too drying. It dries up too fast. So use the 75%, you can massage it easier. But I suppose in the area, like if you're bleeding the hand, you can massage it a little bit before you bleed it. But his technique is to use the cup. So you don't really need to, right? You don't really need to massage the area if you're involving a tendon or a muscle. But if you're doing the digits, like the fingers and the toes, that idea is the same as the ear because there's less blood flow, right? So you can massage the fingers a bit with alcohol first. And with 75% alcohol, it won't dry out as fast. So you can massage a little longer. And then another second tip that is very good that I learned from Dr. Huang is in order for the blood to come out and you don't want to do the squeezing, is you want to use a wet alcohol swab to clean the puncture. So you're puncturing and then you clean with the wet alcohol swab. Then blood will keep coming out. Clean it again, it'll come out. Clean it again, it'll come out. But if you use a dry cotton ball, you clean it, the blood might stop. Okay, so did you get that? That's a very good tip. I find it so useful in my practice. You just use a wet alcohol swab and the blood will keep coming out until you feel like, okay, that's enough bloodletting. Then you stop. And put a little cotton ball, dry cotton ball there, and it will just stop the bleeding. Okay, next, what does it mean when the cup looks misty or has water vapors? So this means the patient has dampness. So either they like to eat sugar, dairy, something cold or raw, right? Icy drinks. And this doesn't always necessarily mean that the patient's gonna be a little chubby, because last time we had a patient, she was so skinny, like maybe 5 feet tall, 90 pounds, and she had this. Then we asked Dr. Diao, she doesn't look like she has any dampness. So we asked her, and she says, my diet is great. But then finally she said, yeah, but I like to drink icy cold drinks. I never drink anything that is hot or room temperature. Then we thought, oh, okay, yeah, that's it. That's the probably the spleen qi deficiency that's producing the dampness, even though she's very skinny. All right, next one, contraindications on bloodletting. One is patients who are on blood thinners don't bleed. Number 2, diabetic patients don't bleed. This is a general contraindication, okay? But if you have to, because you're a practitioner who is always weighing the risk and the benefits of your treatment, if the benefit of bloodletting weighs the risk, then go ahead and do bloodletting, but do a small amount. Be careful. Okay, so we're pretty much done with all the little tips and the principles of how he does the Ashi point needling. So let me go to the Q&A session real quick, answer only a few questions, and we'll take a break and then come back with the model to do the demo, okay? So first question from Janet says, in the last class, you talked about a pain relieving formula that involves soaking Honghua in vodka. Please review that. Oh, it's not in vodka. It's saffron, which is Xi Honghua. It's not the regular cardamom flower. It's saffron, the powerful one. Remember in school, we learned 2 kinds of Honghua. One is the regular one that costs regular price. The other one is the one that costs like $4 or $5 for each gram. And that's the one you use, saffron, and put it in gin. So gin is made from juniper berries, and juniper berry enters the heart channel. So this remedy is very good to clear up the clogged pores. I mean, not pores, clogged vessels. So it's very good for atherosclerosis, good for clearing the vessels. And it's very strong. So it's not something that you should drink all the time over a long period of time. So it's something I would say if you have a strong constitution, you can do that like once 1 month at a time, maybe every other month. But if you're deficient, then don't do this, Or if you do this, you need to add tonics to it. And the ratio is 20 grams to a 1.7 liter of gin. So the big bottle that you can buy that in Costco, the big bottle of gin, and just put 20 grams of saffron. And make sure when you're buying saffron that you're buying the real one, okay? There are a lot of fake saffrons out there. Second, would it be useful to add e-stim if you're using a smaller needle to make up for not using the thick needle? Well, that's a great question, Alexandra. Let me ask Dr. Dell. 廖医师，有人问说啊，如果病人受不了那个针太粗，可不可以用那个就是那个电刺激？电疗，就是用细一点的针，但是加电疗。
电疗没用。
Okay. Did you hear his answer? He says no use.
电疗没有酸胀的。
So the idea of the electrostim, he said, does not produce that swelling and the chi sensation that you would get when you're trying to penetrate through the knot. Sorry if I'm speaking a little loud because he's over 80, so a little bit hard of hearing, so I need to speak a little louder. Next question, how do you remove the cup that is so full of blood without making a huge mess? That's practice. From an anonymous attendee. I think I have posted a lot of his videos on my personal Facebook page too. You can feel free to look on my page. I also post it sometimes in the Chinese bloodletting group. Dean Mosher has a group. I would post it in there because I know those guys like to look at that, and he is really a master at bloodletting. When he cleans up the cup, it's really smooth. I don't even know how to describe it. In his previous videos, if you go and watch those, you can see he would first release the cup, and then he would, if this is the cup, right, and then there's blood inside, he would hold it in this sense and then push the blood with the tissue or with napkins actually, or paper towels. Yeah, that's right. He doesn't use tissue because tissue does not catch blood as well as paper towels. He would slide it at an angle and push the blood in and then hold it up like this. That's the best description I can give without actually showing you how. So you can watch it, sort through my posts in Facebook or actually on his playlist on the YouTube channel. Dr. Dell has a playlist on the eLotus YouTube channel, or just go to his previous classes. You can see how he actually does it too. All the patients, I think he did bloodletting on all patients, I believe, maybe with the exception of 1 or 2 in the last year. But you can see how it's done, and you just need to practice in order to be good at it. And then remember, the blood has congealed, right? Before we remove the cup, it's not very liquid blood that's going to flow everywhere. It is sort of in a little bit of jelly material already, jelly-like consistency. So there is some loose blood, but not that much. Okay, sounds good. Let's take a break for 10 minutes, and then we'll come back with our demo. 好，休息一下。